patient starts with what? Exactly. No, for a trauma patient. We want to start with vital signs. And we're doing this is because we need to take vital signs every 5 minutes for an unstable patient. Because if their vital signs change even just a little bit, especially for an unconscious patient, it's a good indicator that there's something majorly wrong with this person and we need to get them to the hospital as soon as possible. So we start with vital signs. The next thing we need to do for this patient is what? We can't get this from the patient, so we need to ask who, what?
Witness or family.
What do we need to ask them?
Sample and QRST.
Exactly. Try and get it from the family if at all possible, because they're going to give you a more accurate history. They're going to know if they have allergies, if they have medications. From a bystander, all we can really ask is what happened at that time. They can only tell us what happened on the scene. Next thing we need to do is we need to go into a rapid head-to-toe using what acronym? Don't forget, there are 2 D's, 2 C's, 2 P's, and 2 B's. Well, look at your sheet. There's 2 in D, 2 in C, 2 in P, 2 in B. You need to know. You need to know the acronym.
I thought you were saying there was 2 letters each.
Well, no. There's 2. There's under D. There's 2. Under C. There's 2. Under P. There's 2. Under B. There's 2. You need to make sure you know all of those. You can't say just one. We need to know we need to make sure you know the acronym. Okay. So, give me D. C.
Contusion.
Crepitus. A. You guys try not to look at your book at all, if at all possible. If at all possible, if you need to look, that's fine. I understand that you guys are still learning it, but it's at this point you should know it. You should know the acronym, at least the acronym. P.
Penetration punctures.
All right. T.
Tenderness.
I'm sorry. Give me B. I'm sorry. I always forget the B for some reason.
Bleeding.
And
Bruising. Burns.
burns. We already know what T is. L.
Laceration.
And S.
Swelling.
All right. Who's confident that they know the head complete in and out without looking at the book? Come on up. Don't help them until I ask you to help them. Okay, guys?
PSI, all that good stuff. Okay. Then you're gonna start the back of the head.
You want to stand over here?
Yeah.
Make it easier so everyone can see you.
Oh, and then
Let him in, guys.
Feeling this?
Oh yeah. All right, guys, listen up.
You start with the back of the head. Feel back behind the neck. Pull your hands out for like bleeding if he's behind the head. You're gonna go over the ears. Make sure there's nothing behind the ears. Come up on the right under the eyes. Just touch it gently, all the way around the nose too. Cheekbones. You're gonna feel for them. You're gonna go down to the jaw, around the jaw, then feel along the sides of the jaw down towards the neck. Then you get the neck, and then you go out from there.
You left everything out.
Okay.
It's like I was saying earlier. You guys are adding in a lot more than you need to. All I need you to do is walk up to the patient. I check the scalp for bleeding. I check for deformities. I check the eyes for raccoon eyes. I would check for pearl. I would check the nose and the ears for drainage. I'm checking for CSF. If need be, I'll do a halo test. Checking the back of the ears for the mastoids. And if I have raccoon eyes, that's a good sign of a late sign basal skull fracture. I'm checking the face for facial symmetry, and I'm checking the mouth and the jaw for deformities, and I'm also checking to make sure there's nothing in the airway. Done. But you need to make sure that you say what's on that sheet. You forgot. You didn't even say mastoids. You didn't say anything about drainage from the ears and the nose. You didn't say facial symmetry. You didn't say raccoon eyes. If you don't say it, what's on that sheet, you're not getting the points. That's why I can't have you guys making things up or trying to reword what's on that sheet. what's on that sheet has to be said. Okay? It's very important. Because I'm one of the easier graders. There's other guys in here that are just like, that just don't care. That some people don't want new EMTs out in the field and will do whatever they can to fail you. Oh, I'm not going into Harry yet.
Fucking Harry.
He's his own story. I mean, he's been through a lot of shit. Make sure whatever's on this sheet is said. This one and OB and your neuro have to be verbatim. They have to be. Because if not, you're going to miss a point. And if you miss a point, you're going to fail. I don't want you to fail. All right?
I noticed you said to check for like raccoon eyes and stuff like that. Yet it's not on the thing. Should we say?
If you want to. I mean, as long as you include mastoids.
Yeah.
And I'm just letting you guys. That was just an FYI. If you guys roll up on scene and you have a patient with raccoon eyes and mastoid or battle signs in the mastoids, there's a very late sign of a basal skull fracture, and they are in some serious hurt. Okay? So don't worry about raccoon eyes. As long as you mention the mastoid, the battle signs behind the mastoids, and you check for pearl, you check for drainage from the nose and the ears, you check for facial symmetry, and you check the mouth and the jaw. You should be good to go. And the scalp. You should be good to go. Who wants to do the neck? Nobody?
I'm scared.
Don't be scared, dude. All right. In the neck, there's a lot of things that we need to look for, but there's also a correlation between the neck and the chest. So there's a few things in the neck and the chest they're gonna repeat itself. A couple being the subcutaneous emphysema, the accessory muscle use. Those are two. We have one in the neck that's going to show up in the abdomen, which is going to be your implanted devices and stomas, right? So there's a few things that we can kind of think about that if we're in the neck, I can look towards the abdomen and be like, all right, don't forget, don't forget, don't forget. I've got a few things up here that if I get lost when I'm down here or up here, I can kind of correlate between the two. So there's a few tricks that you can think about. So we come up to the neck, we're checking for JVD, which is a late sign of what?
Tension pneumothorax.
JVD, not tracheal deviation.
Jugular vein distension.
Yes. It's a cardiac. Not stroke. CHF. Yep, CHF. So we're checking for JVD. You're going to know JVD. The jugular is going to be sticking out like you're just going to be able to walk up like, oh, that guy's got JVD. Cool. JVD, you're checking for tracheal deviation. Now, tracheal deviation is a sign of what? Collapsed lung, tension pneumothorax, hemothorax, whatever it might be. The trachea actually deviates to the good lung. So you're going to know right away if it's deviated to the left, they have a right-sided lung collapse. Okay? That's an ALS situation. You need to get them out there soon so they can relieve the pressure and get the lung back up. So you've got JVD, we've got tracheal deviation. We're checking for stomas, which is going to be a hole in the neck. We're checking for subcutaneous emphysema, which is when you feel it, you're not going to see it on the surface. Right, it sounds and feels like bubble wrap. It's actually kind of cool. It's not a good thing, but it's kind of cool. Subcutaneous emphysema, we're checking for accessory muscle use. We're checking for medical tags. Missing anything? We're good? Oh, we're still in the neck. Oh, okay. Yeah, I'm going to, hang on a second. I'll go take that. All right, so don't forget, subcutaneous emphysema and accessory muscle use we're also going to see in the chest. So when I come down to the chest, I'm going to auscultate the lungs. I'm going to check for subcutaneous emphysema, accessory muscle use, sucking chest wound. Anything else?
Flail chest.
Flail chest, which is basically a collapse wall. A flail chest and paradoxal motion are almost go hand in hand. That is when you have more than 3 ribs broken on one side. And that side, when you breathe in, sucks down. You're going to notice it right away. What you want to do is you have to try and they recommend. I've never seen it done, but they recommend using a sandbag to keep it